you can be fully satisfied sexually, and that was a myth, without orgasms. No, you can get pregnant without an orgasm. But women again and again rate the sexual satisfaction of a relationship based on their ability to experience orgasms. So the more orgasmic a woman is, the better that relationship is going to be rated. Thank you so much, and again, it gives me great honor to be talking in front of this august audience, and I see so many friends, colleagues, well-wishers, teachers in the audience, so with your blessings, I want to introduce a slightly different take. I want to ask you, would you know an orgasm if you didn't actually experience one, or you didn't know how to describe it? I remember, this is my earliest experience of being on a Ferris wheel. I was at the top, of this basket, and I could see the green fields around me. I could see the people down there, and the sounds of, horns and kids screaming, and, different kinds of audio stuff blaring through that fair, it was coming into my ears. And I could feel the wind against my face as the basket came down. And that stomach-turning experience, that the heart rate going up, my ears closing, and the tingling on my skin. And as the basket whirled down, this experience exploded in my brain. And I want to bring to your attention that all of us have experiences like this in our lives that can form a platform for developing orgasmic experiences. But I also want to give you an indication that your ability to orgasm might save your life. It is an indicator of your overall well-being, of your metabolic fitness, of your endocrine fitness, your cardiovascular fitness. It is a magical experience. That key of completely losing your mind, which in French is also called le petit mort, which is a small death. It is like you completely absent yourself. That is the key, that experience that happens at the peak of orgasm. So, DSM-5 talks about orgasmic dysfunction as women who either experience delayed, infrequent, absent, or diminished response to a specific experienced or consistent stimulation that they should have experienced orgasm with, and women can have primary anorgasmia or secondary anorgasmia. And the reason I brought up anorgasmia in female sexual dysfunction is because, as we go ahead, I'm going to tell you why women rate orgasms as a key factor in the enjoyment of a sexual relationship. But if they've never experienced it, does it doom them to never experiencing pleasure? Or if they've experienced it before and they can't experience it anymore, can they be trained? Can you actually train yourself to have a predictable, easy, exciting orgasm? And I want to say, yes, you can. Sexual pleasure is the hallmark of a great sexual relationship, of a good sexual relationship. And most of the time in evolution, we heard a wonderful talk about the evolution of sex yesterday, but I want to say to you that most of the time, women's sexual pleasure or enjoyment is never given any kind of importance. They're never asked. Yet, in studies which ask women about how they rate their relationship, women who experience... Sorry, am I audible now? Yes. Is it better? Okay, good. Thank you. I want to say that there are certain predictors, good predictors of becoming orgasmic. And cardiovascular health and endometabolic health are two very important key markers of becoming orgasmic. And there was a study that came about that suggested that if a woman tries, she educates herself, does all of the stuff that becoming orgasmic and becoming clitorid taught you about, and you still can't orgasm, go check your cardiovascular function. And I come to the point then that we used to say about, an apple a day keeps the doctor away, but actually, you don't need the apple. You have an orgasm a day, you probably have better sleep, better cardiovascular health, better engagement with life. And in fact, if you talk to Dr. Rao isn't here, but I really love the way he says, a woman well serviced is really visible. And you can look around you, and I'm warning the ladies, if you're orgasmic, it's visible. It's visible. How? Because you're dynamic, you stand straight, you speak well, you elucidate your points. An orgasmic woman is a force to be reckoned with, which is why female sexuality has been kept under the lid for so many years. People are afraid of an orgasmic woman. But the problem is that it takes time. A woman is, like Dr. Rao says, is istri. She takes time to warm up. And this study on the orgasm gap was done by Durex in the Netherlands, and they found that most men, not all men, most men, over 90% of men, will experience the pleasurable sensation, the le petit moi we talk about, as orgasm in their brains at the same time as ejaculation. Most women in heterosexual relationships do not. Less than 50% of women actually experience an orgasm during sexual intercourse at the same time as their partners do, or even if their partners do. Less than 30% of women actually experience orgasm from penovaginal intercourse, which then takes us to the point that all this study about orgasm is slightly misplaced, because they are focusing on the genitals. They are focusing on the male erogenous zone, which is the genitals, testicles, etc., and expecting that women should have orgasms just through the clitoris and the vagina, and focus on only giving O shots, P shots, C shots, whatever. When you look at the orgasm gap and you look at what people or what young adults talk about their experience regarding the orgasm gap, all of this stuff comes out. Who's talking about genitals? Nobody. They're talking about basics, like communication, like an unskilled partner, lack of knowledge, lack of intimacy, socio-cultural expectations. Oh, she faked an orgasm. What else is she lying about? It's a ground for divorce. How dare she fake an orgasm? I'm not man enough to take it. Actually, women's orgasms are complex, and this theory is something you might want to remember. The 4 nerve complexes, 6 systems, and remember, oxytocin is not just a hormone, it's also a neurotransmitter. In fact, oxytocin in the body is responsible for brain health, it is responsible for cardiovascular function, it is responsible for vascular dilatation, the flushing that you experience during an orgasm, the nipple erections you experience, all of that is oxytocin mediated. This pathway occupies more of the body than most men will ever know. Because they don't. Because the woman doesn't know. She doesn't know. And why do we know that? Because when we look at expanded sexual response or expanded orgasms, there is a ladder effect. There is also a comparative effect that women, even women who learn about their own bodies, when they understand that the whole body experience, the non-genital experience of orgasm is just as important, they are 50% more likely to experience multiple orgasms. They are also 50% more likely to want to learn to masturbate and persevere with their masturbatory experiences. How many of you as sex therapists want your patients to learn how to masturbate simply because you want them to take charge of their pleasure? So all the burden is not on their male partner. We do, right? But many women, when you ask them, are you persevering with masturbation? I have a couple recently, and I said, a psychiatrist prescribed sex toy to the lady who's not experiencing any pleasure. I said, well, how long do you spend masturbating? Oh, 1 or 2 minutes, it just doesn't do anything for me. So, well, what about mutual masturbation? No, that doesn't help either. Why? Oh, the whole thing is just like, how much time do you spend in foreplay? Oh, about 3-4 minutes. This couple has no idea that the female body has something called an expanded sexual response. She has no idea what her body is capable of. But Is she untrainable with a normal body? No, of course she's trainable. She can learn. When you understand that the erogenous zone is not just the clitoris, it's the whole body. But the local determinants, the clitoris, there is a formula, the clitoris to vagina distance is important for penovaginal intercourse, or you need to stimulate the clitoris continuously for 20 minutes before anything will happen. But look at this. The erogenous zone of the clitoris extends all through the introitus, the urethra, the anterior vaginal wall, the whole structure, and the foundation is actually the relationship. The foundation is communication about how this works. The foundation is the communication about the expanded sexual response. Somebody spoke about the C spot and the G spot, and then the A spot, and the cervix spot, and the uterus spot. I want to say that when we restrict women to just understanding their genitals, just understanding their spots, they actually ignore the key of becoming orgasmic, which is to occupy the body. You cannot experience lipati more if you are disconnected from your body. So when the author of Becoming Cliterate, she talks about this, do you give yourself permission to feel pleasure? And most women are denied pleasure. My mother, and with no disrespect to her, if she sees me having fun, she'll say, what's making you so happy? Itna kyun has rahi aaj? Kal rone ka time aayega. So this is what mothers do to their daughters. This is what our families do to us. They kill the bud, the excitement, the exhilaration of life itself, of occupying your body. And women have to relearn how to do that. Women have to relearn that it's not just their clitoris. It's not just one or two spots on their genitals. It's the whole experience. It is the joy of the fragrance, what Madhumita was talking about, the joy of being able to enjoy your shower, the joy of wearing an amazing, this material, soft, amazing, the way it drapes you, enjoying that in your body. Then, of course, it's about your ability to look after yourself. Look after yourself physically, mentally, and also genitally. The clitoris itself, if you don't use it, you lose it. It happens at any age, young, old, and particularly as women go through menopause, this clitoris, this hood starts to shrink, it gets encrusted. Becoming orgasmic maintains its sensitivity, it maintains its health, it maintains its vascularity. Women who orgasm have better pelvic floor health. They have better supply to the vagina. They are less incontinent. They have lower risk of having prolapse. These benefits of orgasms, women need to understand for themselves. It is their benefits. It is not in service of somebody else. We understand the biopsychosocial model, and all of these factors can become inhibitors of orgasm. Women, it doesn't take much for a woman to inhibit her orgasm or cut her orgasms off. Negative expectations, thoughts, previous trauma, perspectives about pleasure, hidden messages that sit in the back of your mind, all of these can interfere and create blocks. You can be fully satisfied sexually, and that was a myth, without orgasms. No, you can get pregnant without an orgasm. But women again and again rate the sexual satisfaction of a relationship based on their ability to experience orgasms. So the more orgasmic a woman is, the better that relationship is going to be rated. Most men get hung up on fake orgasms. But I want to say that orgasms come with practice, and we already know from research that the more often a woman is orgasmic, the more she learns about her body, about the intensity, the different kinds of stimulations, the foundations it takes to make those stimulations work in a particular way, to make the orgasms more predictable, is what's going to benefit her, is what's going to help her. So why be so hung up about fakeness? There's nothing fake about practice. Otherwise, you wouldn't have tutorials and everybody goes to standard 12 classes. Why? You do practice exams. Why are guides so important? You practice. Simple. Practice orgasms. Why not? It's good. You learn different ways about stimulating your body and becoming brighter and more energetic. Basic standard operating procedure, you heard this from Dr. Sharath yesterday, how to evaluate somebody with a sexual dysfunction. This is just as important in women who complain of not feeling satisfied or not feeling pleasure during sex. You do exactly the same thing. You follow a systematic plan so that you don't forget. You don't miss important things. You don't miss the importance of evaluating her hormonal function, her cardiometabolic function, her physical function, her mental state, psychological state, the relationship state, and you progress step by step from the Plicit model, from giving them permission to talk about their issues to then giving limited information and intensive therapy, which can also include sex toys, psychosexual therapy, it can include clitoral stimulation, include lubricants, vaginal estrogen, energy-based devices, lasers. All of this stuff is part of the repertoire which comes with intensive therapy. Anorgasmia, when somebody doesn't orgasm at all, look to all of these factors, but also look to that 15% of women who have a specific biological factor or metabolic factor that stops them from becoming orgasmic. Like I said, even after adequate stimulation, when you've sorted out the relationship, if somebody is not becoming orgasmic, you need to evaluate an organic cause for it. You need to check out her cardiovascular function. You need to check out her endocrine function. Cannot ignore it and say it's all in your head. Go improve your relationship. Go learn about your body. No, you as a clinician, you do the whole works. You do the physical examination. I had a patient recently, a cancer survivor. Ma'am, I'm going to need a little bit more time, please. I only have a minute left. She had colorectal cancer at the age of 30. She was treated with chemotherapy, radiotherapy, and as Dr. Ragini said, zero counseling. Obviously, nobody talked about their sexual. Oh my God, we saved your life. You want to be sexual? Are you nuts? Who told you that? Oh my God, if you're intimate, maybe you'll release hormones that make the cancer come back. Hello? None of the reports suggest that her cancer is estrogen dependent or any kind of hormone dependent. Which idiot said that becoming intimate and having sex is leading to cancer or makes cancer come back? Nonsense. It doesn't. Nobody said that. So this couple has been living separate lives. Finally, when the husband says, now I can't take it anymore, she insisted that she wanted to have vaginal reconstruction. When she came to my clinic, she has been menopausal now for 3 years. Her estrogen levels are in the bucket. Her LH, FSH are through the roof. She has no nipple sensations. Her vagina is non-existent. Her urethra cannot be seen. Her clitoris is completely hidden and fibrosed. She's only 34. Is she anorgasmic? No. She's not. But she has restricted herself and told herself that becoming orgasmic might make her cancer come back. So as clinicians, we have a duty. We have a duty of care to look at our patients' lives as a whole and bring them back their orgasms, bring them back their experience of pleasure in their bodies for however long they've got. She may not live another 6 months, but she deserves the quality of life she deserves that is filled with pleasure, joy, excitement, every single moment that she lives. We talked about the sexual arousal circuit, and in women, these breaks create a big issue. Sex therapy, psychosexual therapy, different modalities including hypnotherapy, touch, EMDR, trauma therapy, trauma-based therapy can help remove these breaks. These are some myths, and what I want to say is that when women practice becoming orgasmic, these myths just fade into the background. Women's ability to have multiple orgasms is a power that they need to exercise, but they can't do it unless they know themselves. They can't do it unless they know their bodies, unless they practice, unless they learn what the orgasmic platforms are. There are different predictors of orgasms, and you can build triggers, orgasmic triggers, and orgasmic platforms. We know from research that the communication between partners, I want to say that even men, what makes you get more aroused? What turns you on? It is your love making that makes your partner come alive that turns you on. This couple that I talked about, where they have no pleasure, he said, I don't have any pleasure. She doesn't feel any pleasure, so I want to divorce her. See, learn how to pleasure her then. The, you can't get anything without giving something first. When partners empower their partners with their love making to express themselves fully with communication, where they're open to learning, where they're open to being instructed as to how they can become orgasmic, that relationship flourishes. And when we look at all of the studies that look at markers for good orgasms, they include things like health and fitness and the expanded sexual response, but they also include a relationship where the partner is willing to learn. So that is why women in longer term relationships which are happy in communication actually have women who have experienced orgasms more frequently and more predictably. So you can have a priming effect, and that is, I'm bringing you back to the point where I talked about that Ferris wheel. You can have a diary, a journal, an experiential journal of all of the times when you had orgasmic experiences, including going to the gym. Why do you think the gym works? Why do you think there is such a thing as exercise-induced orgasms? Because we have something called mirror neurons. When you witness other bodies being amazing, functional, when you see them expressing themselves optimally, you want to do the same. And an orgasm is just that. Sex toys are an amazing tool for helping with orgasms, and we know that in relationships where sex toys are positively held, those women in those relationships do better than in those where orgasms are not held in, or sex toys are not used optimally. If an artificial intelligence-based sex toy can teach you about orgasms, isn't it our duty as women to learn how to become orgasmic? And today we have tools. We have tools like this vibrator. We have tools like OMGS, which you can sign up to learn how to become orgasmic, learn about your orgasms. Different patterns, whether it's a wave pattern, the avalanche, and whether it's a volcano, different kinds. Different women experience orgasms at different times in their life differently. Some women get used to experience one kind of orgasm. It's all welcome. It's all welcome. You could be like that woman who was afraid that if she had an orgasm and her partner had an orgasm, it would all finish. So she was afraid of letting go. What if an orgasm could be like this wave? When you're on the beach and you're experiencing the sand between your toes and the wetness of the wave, you don't hold on to the wave. You let it go. And then the next one comes. And then you let that go. And then you let the next one comes. You don't hanker or crave after the waves because you know that they're going to come. I'm going to leave you with this, with the story of one of my patients who learned how to become orgasmic. 10 years, divorced, never had a partner, found a new partner, learned to become orgasmic, became fit, excited, got a new job, dynamic. She turned up in the clinic smiling, amazing, uplifted, the pure orgasmic woman. I want to ask you, who do you know needs to learn how to become orgasmic but doesn't know it yet? Thank you.
I have so many of my patients, young couples, recently married, and the male partner is very satisfied and female partner is absolutely ignorant what's happening. They have no idea of orgasm, and they just want to know, and the male partner is very willing to do whatever it takes, and education is required, and we require a lot of communication, and we require classes for these people.
Yes, yes. I think if the woman doesn't know what turns her on, she can't teach. And that's where they resort to faking an orgasm. But the point is, as a man, the only reason a fake orgasm would bother you is because you never bothered to find out what the real orgasm was.
Good morning, ma'am. My name is Dr. Charan Singh. Ma'am, I have a few basic questions. First, is the ultimate aim of sexual intercourse is pleasure, or it is just the byproduct of a process of recreation, or how to say, the enhance our progeny or to go into the next generation? First thing, and how do you see its connection with the spirituality? Just for the context, Osho has written one book, Sambhog se Samadhi ki or. Do you see any link between two? Thank you.
The second question has already been addressed by Dr. Raj Brahmbhatt yesterday in his
Okay.
talk, so I won't
Maybe
cover
I missed
that.
it.
The first one, yes, the more we understand, sexual pleasure actually drives sexual activity. If there is no pleasure in the sexual activity, people don't engage in it. So the pleasure is the driver. Progeny is a side effect of great pleasure. If you make sex work, people don't like to do it. And we see this again and again in infertility clinics. The moment you give a couple timed intercourse, sexual dysfunctions start to arise. So you have to reassure them, tell them that if you make sex into work, you're not going to want to go to work. What is the connotation of work? Who wants to go to work? I hate it. I don't want to go to work. And that's what sex without pleasure is work. I have a couple right now, that couple I talked to you about. They go to work every day because their therapist told them, the more sex you have, the vaginismus will get cured. No. Doing more of something that doesn't work is called insanity. Albert Einstein has already told us. If you're doing the same thing and expecting different results is insanity. So sex is pleasure. Pleasure is the goal. Pleasure is the driver of repeated sexual encounters.
Is it also true for the creatures other than the human being on planet Earth?
Yes, we've seen them in many, many different species. We've talked yesterday. Doctor who gave the talk on evolution of sex. They've seen it in dolphins. They've seen it in bonobo monkeys. They've seen it in many different species. They've seen it in even birds who mate for life. So yeah.
Okay, thank you, ma'am.
Congratulations for the very illustrative lecture.
Thank you.
You have raised the right point, that example of the cancer colon. This is the apathy of the modern medicine, that we all specialists don't coordinate with each other.
Yes.
Only cutting is not the job of a surgeon. It should be properly rehabilitated.
Yes.
That is very important. So surgeons or anybody, any doctor, he thinks that whatever he has done is the final.
Yes.
So we should all join hands in coordinating
Yes.
for treating the patient to give the best result to his life.
Yes, absolutely.
Thank you.
Absolutely. Thank you. Thank you for your comment. Thank you.
Morning, ma'am. Ma'am, one question, ma'am. Good morning, ma'am. My name is Ajavi. First of all, ma'am, such a wonderful talk. It was amazing. I wanted to know more about you talked about vaginal orgasm, body orgasm, and different types of orgasm. What are the key differences between them, and if you can elaborate a little more?
Orgasms are felt mostly in the brain. There are physical manifestations of it, which is why I talked about orgasmic triggers. You can build orgasmic platforms. You can build a bank of experiences that allow you to experience orgasms, so that when you go to sexual activity and you engage in sensual touch, like Dr. Madhumita was talking about, and then you engage in genital touch, and then you engage in clitoral stimulation and intercourse and stimulating the G spot or the A spot. All of these things, they are a step ladder approach to experiencing orgasms and expanded sexual orgasms, which is including the rest of the body. And we know from research that when women learn how to engage the whole body, which is why I talked about stepping into pleasure, whenever you experience water, you eat a chocolate, Dr. Madhumita was talking about that. But they don't have to be sexual experiences. They can be non-sexual experiences that enhance your experience of your body. And therefore, when you engage in a sexual experience, it allows you to go in a step-by-step ladder, so that you can experience the trance state that occurs with orgasms.
Thank you, ma'am.
That's one question.
Please.
The last question is more of an observation. Ma'am, I'm Dr. Manish Nigam, psychiatrist from Kanpur.
And many times when we do lot of these type of lectures on orgasm, I just wanted to convey two questions which was asked, and many times they are often referred to me by especially by gynecologists, कि क्या ज़रूरत कि अगर किसी को कोई प्रॉब्लम नहीं तो ज़बरदस्ती उसके दिमाग में डालो कि वो उसको प्रॉब्लम है कि ऑर्गेज्म है कि नहीं है, इंजॉय कर रहे हैं कि नहीं कर रहे हैं. एंड नंबर टू, if orgasm is such a big thing, especially for women, such a big thing, then why do women outlive men?
Why do women
Outlive men. Outlive. ज़्यादा जीते क्यों हैं आदमियों से?
वो अलग है, because the male species themselves have risk-taking behavior which women don't have.
Thank you, man. Can you give me document this so that I can put it somewhere else? Otherwise, again, foxy people will be after me, just like yesterday.
See, there is a difference between the male brain and the female brain. The male brain is influenced by testosterone and it is driven to hunt. The male is driven to hunt, to procure. So testosterone makes them more likely to undertake risk behaviors that lead to early mortality and other factors also. Women need to preserve their health for rearing the family. We're just lucky that we're living beyond 50. Just because we've got the privilege of old age doesn't mean we're entitled to it. At the time of independence, women didn't live beyond 37. Men
Very
didn't
bold
live beyond
statement,
40.
ma'am. Extremely bold statement, ma'am.
So, yeah, you're living a privileged life. Women were never allowed to be orgasmic. Like I gave you the example of my mother. All of the women in this audience know their mothers. If you allow a woman to experience orgasm, she's going to become a force to be reckoned with. घर छोड़ के चली जाएगी. किसको संभालूं मैं? घर come home by 7 o'clock. कोई घर में बत्ती जलाता है उधर नहीं रहना चाहिए. My mother's saying.
Ma'am, don't you think this is quite presumptuous? You are blaming all the males, especially all the male partners, कि वो अपनी wife को control नहीं, बोले orgasm नहीं दे
नहीं
सकते.
मैं मम्मी की बात कर रही हूँ. मैं अभी तक पतियों तक पहुँची नहीं हूँ.
Thank you, thank you. Thank you.
Then ma'am, a psychiatrist and we should always have a good discussion.
Oh,
You cannot get rid of the voice in your head simply because I'm telling you, even if you have an amazing partner, if your mother is always accompanying you in the bedroom, you're doomed. You have to get rid of that. Your ability to heal from your childhood trauma will determine the quality of the relationship you have, no matter how wonderful a partner you have.
what a successful presentation. I request you all for a big applause to Dr. Neelima ma'am. Because I can see here what an orgasmic smiles on all the faces. I request our chairpersons to facilitate Dr. Neelima ma'am. Please, sir.